and herniated disc, they don't need these screws and rods. They don't need metal plates in their neck anymore. But we call these things spinal implants. When you put spinal implants in the neck for an anterior cervical discectomy and fusion, Dr. Deukmedjian here at the Deuk Spine Institute, and we are wrapping up our last surgery of the day. This is number 5, and our patient has 2 bad discs, one at L4-5 and one at L5-S1. The L4-5 is herniated to the left side. We've already gained access through the left foramen. The L5-S1 is through the right side. All right, let's see. Shot. We're just doing our discogram. Let's get an AP. Our patient has a lot of soft tissue, so it makes it hard to see with the x-ray machine, but we are able to see what we need to see. And the L5-S1 disc is always going to be the hardest one to do. Okay. Let's have a stylet. Shot, lateral, shot. Right, pretty good. Shot. That's definitely the lateral border of the disc. You can feel it. Shot. Shot. You okay? We're just about done. I just want to get it perfect. You don't want to come back again, Shot? You're almost done, I promise. Shot, that's a facet. Need to get around the facet. Shot. 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 Where? Where is it? Huh? How far down your leg? To your knee. All right. But not past your knee. All right. Shot. 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 That's the disc. Where? In your back. All right. That's your bad disc. That's your bad disc, my friend. Relax. Take it. All right, I'm going to put you to sleep in just a minute. This is scarred up pretty bad, Shot. You're doing okay. Yeah, it's scarred up. Really bad. Too much scar tissue in the disc, you can't get the dye out. We're going to put you to sleep in 1 minute. How bad is that on a scale of 1 to 10? All right, is that where you typically get pain? Yeah. Let's put him to sleep. You get to go to sleep now. 10 out of 10 at 4-5. I couldn't test 5-1. Just take a deep breath, you're fine. When you wake up, we'll be done. Get your body flattened out where we like it, right there. Perfect. Count from 1 to 100 out loud for me. Shot. Keep counting. So our patient has herniations on both sides. So that's why we're accessing the discs from both sides. And the left side is a huge herniation that's hitting the nerve, causing really bad left leg pain. He couldn't even lay flat in the bed in pre-op. He was in so much pain. He's got back and leg pain. Shot. And we know that he has back pain at L4-5 because we just tested it with the discogram. Shot. So we're going to get rid of that herniation, and we're going to fix the tear in his disc that's causing all his back pain. So we're going to fix his back and leg with this surgery. Shot. Shot. And he's a big guy. I mean, huge. How tall is this guy? 6'4", 6'5"? Shot. Huh? He's not the tallest we've had, but didn't we do a 7-footer or something a little while ago? From Canada? Shot. Remember? And this gentleman is from Minnesota, right? So this one's from Minnesota up north. Our Canadian was our biggest. 6'3". Okay, our Canadian was what, 6'6"? Yeah, I think you're right. He was really close to 7. What do you? All right, patient's asleep. We're getting ready to start the first laser. Pretty amazing, huh? All right, so without further ado, we're going in to the disc. This is, remember, the L4-5. Flynn, time to man up. Time to man up. You know how to be a rabbit. We need you to be a wolf. You understand the difference? Rabbits are the food. The wolf is the predator. Good. See that? You did it. You did a good job. You can do it. Oh yeah. Pieces of herniation coming out nicely. Good. You know, I know your dad. And I know your dad would be proud of you. Do not let this hit your face. Just lean back. All right. How's he doing?
Do we have more weight like this? Yeah. And then I need a blue. Can you wet the blue?
Okay. Grab her. This fucking thing. Like, big tear here. Where's my laser?
we can turn out the
So
lights.
how close are we to being able to run 2
We
rooms?
can, I need to, we can do it. It's just, I need to move
We
stuff
need
from
2
OR.
anesthesiologists.
Yes, but we can do it. But I need stuff from OR1. I want to have their own stuff in OR.
I don't know what
You
that
know what I'm
means.
saying?
No.
Like, I need to use the bed from OR1. I need to use it. I'm sorry, what?
Are you, what are you asking? What are you asking? Yeah.
Yeah. So what I'm saying
Well,
is
no,
that
I mean, that's what I'm
ordered
asking.
already
From an
canister.
equipment standpoint,
Yeah, I have.
from a personnel is a different issue. There is a tear, by the way, at 12 o'clock. Do we have the equipment to do 2 rooms?
I ordered already a couple things that I need,
Like what?
like the 4 canisters stand.
More, you talking about suction?
Yeah, suctions.
Oh, we don't have more?
We have a 2, but we need more than 2.
Got it.
So I already ordered.
What about the pumps?
The pumps is already ordered, so
Okay.
I'm still waiting on that. The bed, I can use the OR1 bed, and the anesthesia card, I can use the OR1.
The
for
new
now.
one.
I'm gonna buy a new one. If
Wait, wait, I thought we already bought a new anesthesia. Oh, cart.
Yes,
Not a machine.
Card means like a store,
Oh, yeah.
keep everything.
Of course.
So.
No, we need to have everything we have here. Look at the tear. There's some herniation, more herniation coming out. Grab her.
I would say if you give me 1 month, we run 1 month, maybe less.
1 month.
Maybe less.
All right. Well, 1 month we should have Flynn trained up.
Yep.
We'll do the easier cases in Flynn's room.
Other stuff, you need to decide which one that you don't want to stream because you don't have the camera there.
Yeah, that's all right. I don't care. That's the least of our concern. We just need to have the equipment and the personnel.
Yes, sir.
So we'd have 2 anesthesiologists and we have 2 scrubs. We have the scopes. We have the, how many towers do we have?
We have 2 towers.
We need a 3rd tower.
Okay.
A Linvatech.
Yeah.
Yeah.
Okay.
Yeah, we need 3rd tower.
No problem.
In case 1 tower goes bad, we need to have a backup.
No problem.
And all 3 towers have to be working
No problem.
properly. So start testing everything, making sure that we have everything working.
No problem.
The camera module, the light module, I don't think we have a recording module anymore, right? We don't use that.
No.
Any questions from our audience?
No question, sir.
All right, well, we had a long day today because our anesthesiologist was sick on Tuesday. So we had to cancel our surgeries and postpone them until today. And we have one for next week as well. So I appreciate everybody's willingness to stick it out and help out. And you have my commitment that we're going to start to run 2 rooms. And running 2 rooms can be a lot better because then we can flip-flop so there's not as much time in between cases wasted. And we'd have 2 anesthesiologists, so I think things would move a lot faster. Now, have I run 2 rooms before? Absolutely. We used to do that in residency all the time. While one patient is having surgery, the other patient is getting put into a room and getting prepped and draped and intubated if they need it. Grab her. So that by the time I finish my part of doing the surgery in one room, I can swing over to the other room. It's called the swing room. And get in there and do the other surgery. But it takes, oh man, a lot of herniation pieces here. Pretty good sized chunks coming out. We knew this was going to be a big herniation. We could see it on the MRI. Oh, stop spinning. We're getting to a point where the demand for the surgery is exceeding our current ability to provide it, and we have to increase our capacity, which is something we can do here at Deuk Spine, but it takes coordination and training, and we have to buy some more equipment. Is he okay? All right. By the way, in case you missed it, this is L4-5. This is the one that has the worst herniation. L5-S1. You okay? L5-S1, on the other hand, is also degenerated, but this one here, L4-5, has a giant herniation. We've already started taking out some of the pieces of the herniation, and we're going to be gradually removing it. As I get more medial on this disc, I can actually find this herniation and remove more and more fragments of it. See how nice the laser is? It really is very quite helpful as a tool. When I first saw this herniation on MRI, I thought, this is a soft herniation, a new herniation, just based on the appearance on the MRI. But MRI appearances can be very deceiving. MRIs can be extremely inaccurate in terms of identifying the abnormality in the disc. MRI can look one way and the disc is completely different. Like this last patient we did, he had a disc that on the MRI looked kind of bad, but not terrible. But when I got in there, it was unbelievably bad. It was like literally the whole disc blew out.
Oh, I asked him what his injury was.
Yes.
And he said it was just a really bad sneeze.
A bad sneeze?
Yeah.
No, there's more to it than that.
I don't think that's it, but okay.
Well, you know, that was more than a sneeze.
Yeah.
You know, I think that whatever injured that disc originally just destroyed it, and the sneeze, maybe that's like this, they say the proverbial straw that broke the camel's back, but there's no way a sneeze could do that much damage. That disc was demolished. It's rare that I've ever seen disc injury so severe. That was the last surgery we just did before this one. That patient's disc injury was massive. All right. We're making good progress here, and I'm happy. We still need to get more medial. There's still going to be more herniation up here. It's just a matter of finding it. Any questions from our audience, Diego?
They want to know how badly damaged is the disc.
How badly damaged is this disc in
Yes.
this patient
Yes.
that I'm working on? It's so far it's a medium. It's like a 5 out of 10. It's not that badly damaged. I'm seeing a lot of potential for regeneration and you know, healing so far. I'm very optimistic, but we're not done yet. So we've got probably 60% done. And right here is where the biggest part of the herniation is, what I'm getting right now. That's all herniated disc right there. So I'm adjusting my tube and I'm moving it out further towards the periphery of the disc, towards the foramen. But I'm seeing a lot of herniation still here. So I would say it's going well, but we're about probably 60-70% done now of this disc.
We have another question. Can arthritis caused by lateral sarcoidosis, excuse me, they want to know what happens after an SI injection stops working.
They want to know what happens after an SI injection stops working?
Yes.
So an SI injection is a sacroiliac joint, and if you have an injection, that means you have arthritis in the joint. Arthritis in the SI joint is very painful, and if it stops working for one of two reasons. One, it wore off. Two, you have pain from some other place. So if you indeed do have pain again from the SI joint, it's most likely because you didn't do the physical therapy, chiropractic manipulation that's needed. The SI injection never fixes the problem. Maybe PRP or stem cells will help, but the injection is always going to be temporary. It's always going to wear off. So what's important to do is the physiotherapy. Everything okay, Doc? All right. Can I proceed, or? He's satting well and exchanging. Good. Good. All right. Let me have the grabber. I'm going to finish here in a minute, and then I'll move to the other side. Do you need more help, or are you good? Good question there, Diego. You have any more?
Yes. Can arthritis cause sacroiliitis?
Yes.
Mm-hmm.
Sacroiliitis is arthritis. Sacroiliitis is arthritis. Anytime you hear the itis, it's inflammation. And inflammation of a joint is called arthritis of the joint. Arth is joint, itis is inflammation. So sacroiliitis is inflammation of the sacroiliac joint. It is arthritis of the sacroiliac joint. Same thing. Remember, arthritis damages joints badly, so you really want to extinguish it if you can, as quickly as possible.
Another question is regarding this patient's MRI. They want to know, does the MRI show any other disc bulges?
The MRI does. The MRI shows a herniation as well at L3-4, which is another disc bulge. But this patient has no pain at L3-4. So we're not treating the L3-4 because he doesn't have pain there. I made that determination based on his preoperative exam. We're only treating discs. I can't move it. We're only treating discs that have caused pain or symptoms. If a herniated disc or bulging disc does not cause any symptoms in that patient, we're not going to treat it. There's no reason to treat every herniated disc in every patient, because the moment you start doing that, you're going to operate on every human being alive, and they're not going to make them any better. What am I getting on this? Is my irrigation down? No, I just want to make sure I have good flow. All right, just about done here. This is the pretty much the end of the herniation, the most lateral part of it. These are sometimes tough to get. That's the end plate, like a bone spur right there that's bleeding, that I just zapped with the laser.
We have another person on YouTube that's 25 and has spondylolisthesis on L5-S1. He's been suffering with it for 2 years. Wants to know if you have any advice.
So spondylolisthesis at L5-S1?
Yes, that's
He's been
correct.
suffering with pain for 2 years. Yeah, my advice is you're probably going to need to have surgery if you're having pain. You don't need a fusion. But it all depends. My advice to you, the best advice I can give you, is submit your MRI for a review. We do a free review. We'll be happy to look at it and tell you. I'm still having trouble moving this thing. You got to get this off of here or something. My advice to you is to have us take a look at it, send your MRI in. Let me take a peek, and I'll tell you what I think needs to be done. That's all the herniation right there. I kind of regret hitting that bone spur because it's just misbehaving now and bleeding. It's not a lot of bleeding, but it's enough to affect our visibility. You kind of have to know where the herniation is. It's at 12 o'clock, right up there, and I'm working on it. It's pushed the tissues backwards towards the nerve roots, and that's what I'm working on now with the laser. It's pushed them towards 12 o'clock. Some people mistakenly think that discs look normal after surgery. They never do. They never go back to looking normal on an MRI. And everyone thinks that bigger the herniation, the more symptoms you should have, but that's not true at all. Bigger herniations frequently have 0 symptoms. Smaller ones have lots of symptoms. So you can't use the size of the herniation to decide if that's a problem or not. That's for the patient. You got to understand what's happening on basically a biochemical level at the herniation. Again, inflammation. Inflammation is virtually invisible, yet it creates so much pain. It's not necessarily a structural finding. It's a chemical reaction basically going on, and it does a lot of damage.
We have another question from YouTube. It's regarding the vaccine mandate.
I'm sorry?
It's a question regarding the vaccine mandate.
Vaccine mandate, okay.
What's your opinion on the nurses quitting or getting fired because they don't want to get the
What's
vaccine?
my opinion on nurses getting fired for not doing the vaccine?
Yes.
I think people should, I have mixed feelings. I have mixed feelings because we do have vaccines that are required in America, right? Rabies, pertussis toxin. Huh? I couldn't hear you. His feet and legs are moving? Good. I would hope they are. basically, I don't have a real strong opinion one way or the other. I myself am vaccinated. I understand the logic behind it. I think it would be probably helpful if people were vaccinated. Should they be forced? I don't know. I don't really have an opinion on it. I don't have the right opinion. Let me put it that way. I don't spend enough time thinking on it to really have an opinion. But I myself am vaccinated, and the reason I'm vaccinated is I have the ability through my connections with doctors to find out what's really going on in the hospitals with these sick people that are infected with COVID. And I was very skeptical of the vaccine myself. I didn't want to do it. I thought it was inappropriate for anyone to tell me to do a vaccine. And I didn't trust the vaccines because they were so new. But then I started talking to my colleagues, doctors that work in the hospital in the ICU. And they were telling me about the patients that were dying in the hospital. And they said all of them that are dying did not have the vaccine. So basically, if the patients had the vaccine, they were still getting COVID, but they weren't dying. They were just having at worst, some disease, mild to moderate disease. So that was what convinced me to get it done. And I did not want to die or have my kids die, so we did it, And in the end, if it's the wrong decision, then so be it. The truth is life is ephemeral. It doesn't last forever, and we're all going to die. So if it's the time, then you're dying. We have no real control. If we think we do, you can do only so much to prevent that death from happening. But I believe that the vaccine is probably the right thing to do, personally. I would not ever force it on someone else. But I believe people should have a choice. But they should be educated, have an educated choice. All right, we're almost done here. This is just a massive, massive herniation again. And it's descending. It's like coming from the roof and coming down. The roof here, 12 o'clock position, is actually, yeah, right up here. That's where the herniation is up there. And you can see it. It's pretty big. It just, I keep zapping it with the laser and more keeps coming down into my field of view to work on. So I got about 5 more minutes on this disc, and then we'll go to 5-1. It's just that fumarole that's really bothering me the most. It just doesn't want to stop bleeding. That's looks like a lot of blood, but it's not. The only thing that blood is doing is making it harder for me to see what I'm doing. But fortunately, I've been in a situation a couple of times, so I think working through it is not a big deal, but it is a bit annoying, obviously, that I can't see as well as I'd like to. But that said, I know the herniation is still here at the 12 o'clock position. That's where my focus is. So I'm just chipping away at it. Grab her. So I always periodically stop and inspect. There's a herniation right there. Look at that. Bam. That was awesome. That's it. All right, we got it. Holy mackerel. Lay still. Stop moving. Let's turn the light and show these people. Stop gawking.
That is huge.
Okay, this is the herniation right there. You don't often get it. But that's it. Yeah, that looks like a baby. Give it an APGAR score, please. So we're pretty much done here. I don't think there's anything. I don't think there's anything left. Please don't move. All right. He's probably like feeling better now already because he's like, okay, surgery's done. Let's move on. Well, that was the herniation.
Alright. Scope off, light on please. Scope off, light on please. Thank you.
Betadine.
You want a betadine or?
Betadine.
I need iodine please.
What is this? So we use a little antiseptic in there called betadine.
You want more irrigation?
I need more irrigation.
Please. More, please. Thank you.
That was pretty cool, huh? Yeah, he didn't like that. I pulled it out right underneath his nerve. And he was like, ooh. Oh my God, yeah. He's gonna feel like $1 million after that. But you see what we had to do to get it? You know? I had to sit there and work on it for, what, 20 minutes? All right, come on in, put some pressure. Actually, yeah, you come around. Lay still. He's fine. He's not moving much. Go lateral, please. That was amazing, huh? I think that's probably our biggest herniation. What do you think, Luis? Yeah? I think that might take the record. I've had some big ones like that, but it's unusual. Usually they come out in pieces. That was crazy, huh? All right. L5-S1. Let's see what we got here. Got the guide wire in, needle out. Shot. Looks good. We'll make our incision 7 millimeters. He's going to have 2 7-millimeter incisions because he is special. He's got problems on both sides. That's why we have to go on both sides. Shot. Oh, it's just overexposed. Don't you think? Shot. It's looking pretty good. Is he okay? All right. Shot. Shot. Yeah, take that. Shot. Yep, there we go. We got 15 minutes, I think. You good on the other side? You want to close it? Shot. Huh?
I'm gonna have Clean help you and then I'm gonna close it.
Shot. That's fine. He's gonna feel a whole lot better, I think, after this. Yep, get it out. This side's not as bad.
Usually the tooth from that side.
Is he doing okay, Doc?
Stop off, please.
Settle down.
Yeah, this side won't be as bad. There's not as much to do here. What's that? This is the one we didn't do a discogram, so there's not going to be any of that nice blue dye. It's just, look at how pink that stuff is. That's all inflamed. Inflamed tissue. That's where all the paint comes from.
We need the step over there, right?
I need the laser pedal. Laser. We should be done in 10 minutes. Louise, close that thing. You hear me? Yeah, let's close it. We'll be done in 10 minutes. Grab her. Now you just put your finger and get perfect, Flynn. Perfect. Nice job. You are the man. All right, Diego, any questions? Do you see that thing, man?
That thing was huge, man.
That was amazing.
Was that your biggest one ever?
It's pretty close to the biggest one that we've ever pulled out. You know, it was a good size. That was a good size herniation.
No questions, but someone is saying thank you for making the MRI review very easy to fill out.
I didn't hear what you said.
Oh, someone's saying that thank you for making the free MRI review very easy to fill out.
Oh, good.
Mhm.
Yeah. You know, the biggest problem with the free MRI review, a lot of people don't have their CD, you know, so they don't know how to get the MRI loaded up. But you just have to get the copy of the MRI from your. Don't move. Is he all right? How much do you need me to wrap it up? No. All right. This should be done pretty quick. We're almost done. So the inflammation in these discs, by the way, I've said this before for those of you who've been around watching, it creates a blood supply to the scar, to the inflammation, and that blood supply is actually, it bleeds, obviously, especially when you do surgery in this area. So sometimes there's more than other times. Obviously, it's a pain in the booty when you get that bleeding going. But, you know, it's like working on a deep thermal vent. You just gotta go with the flow, you know? I don't know what else to say, but you gotta go with the flow. Right, Luis? All right. Just about done here. You doing all right, Luis? Two more minutes. Once again, I want to thank everybody for sticking around. Do not make that mistake. You see that instrument coming to you, you better understand how to take it off my finger. Okay? It's the same every time. It doesn't change. It's metal. All right. You know why doing chores is so good at? Because it teaches people to learn a pattern of behavior. A pattern of behavior means you do something the same way every time you encounter it. Whether you're mowing the lawn, whatever you're doing. We're done. And we're done.
Lights on, stop off, please.
Scope off. Are you okay?
Yeah, it's obstruction,
Of course.
obstructs every night of his life.
Well, hopefully we're gonna change that, yeah. Maybe he can get off some of these pain meds. That's what I expect. I think that's what people want. They want normalcy back, you know? They're on these drugs because the stupid doctors put them on drugs. These pain management docs that don't bother to learn the real reason why people have pain. You know, they just pump them full of powerful drugs that screw with their lives.